Hello, everybody. I'm Bob Dempsey. I chair the Department of Neurosurgery at the University of Wisconsin. And what I want to do is give another update on the COVID situation and try to give a message of hope and resilience to all of us at this time. I know we've been through a lot. I know we will continue to be through a lot, but we've got a lot to be proud of and a lot to be hopeful for. So I want to start by just sort of getting some perspective on where we are, where we wish to be, and why this is a time of hope and resilience. Let's start with the day. Today is Groundhogs Day. Now, I know a lot of you think that Groundhogs Day was a Bill Murray movie or just some sort of silly celebration of the weather. But really, to our ancestors, this was a very important day because our ancestors didn't divide the seasons up just into four: winter, spring, summer, fall, but they also divided those again. So there was a middle point of each of those seasons. And this day was midwinter. This was the day where they really first time could see a light at the end of the tunnel. They had been through a long, hard episode. They could see that there was a future. And then the other times, mid-spring is May Day, this celebration of arriving, of having the flowers blooming. Midsummer was the time to take respite. This was Shakespeare's Midsummer Night Dream, when they were enjoying the good times. And when the fall came and they began to see this darkness coming, they began to think about their own mortality and the Day of the Dead. Mid-fall is what we call Halloween. So of all of those, this time in February for our ancestors was the first one of hope. And so I want to keep that in mind because we've done a lot. We're resilient people, and we're going to be proud of that. But think about where we are. It's been a remarkable 2 years. I mean, in the world, we've confirmed 1/3 billion cases of COVID. And this is almost impossible to count because very few people tested the way the United States did. This is just the ones we've confirmed. It's many times more. 6.5 million deaths. In the United States, 890,000 and rising even during the period that we've had vaccines, because not all of us have used the vaccines. I know that Dane County has been relatively spared because of really good medical practices here, but still, these are amazing numbers, over 100,000 cases. And the difficulty of counting cases from now on is very real. We're not going to really have a good idea because home tests will replace the government testing, and we're not going to be able to keep track. What we will keep track of is hospitalizations, ICU numbers, and deaths. And that is really where we have hope. This is the Wisconsin numbers as of this morning. And what we were talking about in the last presentation I gave, what we were hoping for is happening. We're being able to see cases falling, hospitalization falling, ICUs falling, and very, very recently, deaths falling. We have to think about that. This graph here of cases is important because this was this terrible peak last fall when everybody was dying. But what we just went through is 7 times higher. It's actually way up here. And it was a rapid rise and now a rapid fall. And this point, still at a very high number, 5,000 cases a day, is making us happy because this is actually how pandemics end. They kind of mutate themselves into a common but less virulent form that drops back into the consciousness of society. And it's important to know that when you get less virulent for a respiratory virus, it can become seasonal, something COVID was not prior to this. And what happened is the hospitalizations have started to fall dramatically, almost in half. The ICU much slower. And that's a big problem for the university because we are a major center for all ICU care. And so we are jammed and we're overwhelmed, and we're working very hard, and the stress is real. The accomplishments are amazing, and the care is amazing. And what's happening is now finally the death rates are beginning to fall, and of course they'll lag. So what does all that mean for us? Well, there's two important things to know about COVID and hospitalization. Prior to this latest variant, the beta and the delta, which were so virulent and so fatal, people would come into the hospital sick from COVID, primarily respiratory, and die with ventilator illness. Now, as many as 70% of the people in the hospital with COVID are sick, but also have COVID. And that means they have appendicitis and they have COVID, or they were in an auto accident and they have COVID. Mind you, a large number of them, it's in between. They have COVID, they had a stroke, and that may have been directly related because this huge increase in strokes is directly related to COVID and what we're dealing with. But as we look at this, what it's really telling us is that this variant, the Omicron, is widely spread throughout our society and may be trying to become endemic. That's really one of our next step is going to be from pandemic with major illness to endemic in the background. And we're going to live with it. Because how does a pandemic really end? And why am I excited to see this sudden drop in numbers? Either the virus changes, and that's the mutants, and this virus mutates so often that I'm not really afraid of the new mutants as maybe I should be, because it's rare for it to get as lucky as the Delta variant and become, in the middle of a pandemic, even more virulent. Usually in the middle of a pandemic, it's like the Omicron, it becomes less virulent. This is what happened in 1990. This is what happens with the flu every year. And then occasionally, out of the many mutations in the endemic, one raises up as a sickness and then drops back. This may be the time COVID is dropping back. I hope so. The other reason that we overcome a pandemic is the host changes. Either we do it by vaccinations, and I'm going to talk a good deal about vaccinations, because they're going to be part of our future, and we have to change the way a large part of our population thinks about it, or prior infection. And we don't know how effective having a prior infection is, although it is of some help over a whole population. Okay, watch South Africa. South Africa right now is reopening. They went through this huge spike of really all the variants, although they did a very poor job of really treating that, reporting it. We're quite aware now that they had very large surges because 80% of the country is reported to have antibodies to COVID, most of which from previous illness. We don't know if that's enough to help, but against a less virulent strain, it might be. So as they reopen, let's watch and see how this happens, because if this mutant is less virulent as a respiratory virus, as they come out of their winter into their warm weather like now, it's going to drop down just as spring drops flu down in our country. And therefore, I'm hopeful about the spring here in this country because we're dealing with less virulent variants. It's so common, however, that susceptible people, unprotected people, unvaccinated people are still getting very sick. But enough people are getting antibodies that it might be able to drop down into an endemic stage. What's the effect of a vaccine? Well, it is dramatic. In Dane County, it's a 60-fold factor in death or hospitalization. If you're getting hospitalized with COVID, you're dying of COVID, it's 60 to 1 that you're not vaccinated. And that's amazing because it's really only about 30-35% of our population that isn't adequately vaccinated in this county. But about 10% of the people you see are probably infected now. And why do you get to see them and get by? Well, one, you didn't get a very large dose of that virulent from them. Because if they're not sick enough to be coughing and hacking, not much is going to be spread. Two, you're wearing a mask to protect yourself. And three, you're boosted. So what through few viruses that might get across to you or to your mask or through your mask, your antibodies take care of. And that's how you overcome such a thing. This combination of your safety measures, your vaccination, and the difficulty of this virus of spreading because people aren't quite as sick. That's what I believe is fueling the sudden drop. What comes next as the weather changes is hope and resilience. Where do the vaccines fit in this? Well, there's two major things to watch. One is the vaccine for young children, 6 months to 5 years. We know that the tests are ongoing. We know that there are submissions now for approval, and we know that they're based on safety. Therefore, they're likely to be approved with a possibility that this will be available come March. That can change families overnight as far as safety, as far as mingling. There are elders who might be more sickly with their children who might have been a reservoir. That can change everything we do. And boosters, which will be specific to the variant. That's what we do for flu. That's what we're going to be doing for COVID. And I predict we'll be doing it on a yearly basis to try to keep it in the background like a common cold and not allow it to be so common that it mutates again virulently. We hope it mutates less virulently because it will mutate. So as cases drop, what's the future going to look like? Well, the first thing I say is watch South Africa. Will this just become another seasonal respiratory virus? If so, I have great hopes for the spring here, and we keep up with our booster program. We will live with it. We're going to be masking for a while, but even that, as the numbers decrease, will become less common. Right now, common sense says protect yourself. And we're likely to have boosters because we know that this particular virus, the antibodies do wane over the course of the year. And therefore, a booster annually is got to be expected, just as we need it for flu. And variants will happen. It's my strong hope and scientific possibility that they'll be less virulent, as Omicron was compared to Delta. And we hope that that just repeats. So, what do we do as people? What do we do as doctors, nurses, staff? Is we meet the stress because it's very, very severe now. I'm well aware of it. In me, in you, in all of us. We're seeing young people getting sick. We're seeing people who have a mild COVID case and then a bad stroke. And we're sure it's because of the vasculopathy which resulted. But we have optimism because we understand it and we're good at this. And we have endurance. You have to have that to be in medicine. We can do this and we will. And I can see on this midwinter day the light at the end of the tunnel, the spring that's ahead. But be realistic. We don't stop our precautions now. I increased my own personal precautions when I saw this uptick because I knew it'd be so common. Everybody around you. I'm not going to drop that down just yet, but I'm watching. Take care of each other. I mean your family, and that's your blood family, but that's also your work family. That's the people who, like you, care for people whose health care needs are so very, very critical. Be proud of what you do as I am proud of you. Because yes, we are seeing a possibility, a reason for hope. And it's all because of what all of you have done and continue to do every day. Can't thank you enough.